Great. Um, Thinking about the conference in general, are there any other things that kind of stood out to you that you thought were exciting, whether it be the poster session or any of the keynote
Oh,
sessions at all?
yes, of course. The conference was amazing. I told you, it truly had a great impact on me. I feel like I'm more connected and I'm learning a lot. And I had a lot of questions like clinical practice. We are confused sometimes with some complicated case, and we don't know which decision to take in terms of like patient benefit, and you have the other risk to cut down to prioritize which one. So it helped me a lot, and I would say we shouldn't like miss this kind of like conference. I'm very happy, very inspiring endocrine community. I would say that we are lucky to have this kind of conference so that we can share our thoughts, we can learn from each other, and we can build connection like bigger community.
Yeah. Are there any kind of particular insights that stuck with you the most from the conference at all, or anything that you think is gonna the most heavily impact your practice moving forward?
Yes. So now that we came to the conference, we have like we are practicing like according to the guideline based on the patient and our experience. But definitely from like whatever like last 3 days, I would say very valuable and inspiring these days. There are not only one, two, three. I can't explain in words. There are a lot of things that I'm planning to like apply in my practice when I
Mhm.
go out.
And then what are the next steps for you in your research? You talked about maybe continuing to follow up. Are you gathering or still searching for kind of these case studies, and
Yes.
how are you following up with some of the cases that you've already identified?
So the three cases that I have, one, two others, we are still following up, and meanwhile we're gonna find like if there are other cases like this, and the genetic testing that I wanna see like how are they and the syndrome men one or like other men syndrome are they how common they are in the community like I'm looking forward to it. Maybe next conference I would come up with more case series so that we can at least have an idea of what are the spectrums they're presenting and how they're genetically like more correlated or not.
And is there a specific geographic location where you're searching for cases? How do let's say if there's a case identified at Northwestern, for instance, in Chicago, how are you kind of gathering those cases?
So for now, for this instance, I'm gathering the cases from the from my practice that we in Brooklyn, New York. But I think eventually, when my number of cases goes higher, I might invite other facility all over the United States, maybe because we are meeting here in ACE conference, and in future maybe all over the world. We can like create connections, social media, and we can gather cases, and maybe we get more cases from other part of the world in the United States, then we can have more bigger studies on
Mm.
that.
Yeah, I wonder about that a lot too, just because, especially with rare diagnosis, even when we think about things like personalized medicine, and we find that people with various life experience, whether you're talking about the epigenetic factors that come into play, there's so much that we don't know that I feel like we need to make sure we gather as much data as possible.
Yeah.
But if someone isn't like explicitly doing like a study and recruiting people, I feel like this data is just siloed in different places. I'm wondering, is there in your field, is there any kind of hub or place for people to kind of gather rare cases of particular diagnoses, or does that exist, or is it all kind of from a case by case basis, where each kind of doctor is doing their own work to kind of understand the cases around them? Does that make sense?
Yeah. So for now, we don't have something like that, the hub that you are talking about. But I'm thinking like if we get more, like as I said, just started my practice last year. If
Mhm.
we get more, we might be able to organize a team, like looking for interesting cases and get them connected and keep follow up, like not like other regular people who are healthy controlling their disease, the rare cases. Maybe we should have a might be able to create actually a special group for that in terms of resident fellows, even the office like team ancillary staff and everyone.
Perfect. Thank you so much for taking the time to share your work with me. Is there anything that we're missing?
Thank you so much for inviting me. I'm like so happy to be here, and I'm happy to share my cases. And at least I think I it might have effect or awareness among general population.
Definitely. Thank you so much.
Thank you.
It's been a pleasure.